Lung cancer is a tumor that arises in the lung. There are different types of lung cancers. They can start within the lung tissue itself or within the airways. The main types of lung cancer are non-small cell lung cancer and small cell lung cancer. Within the non-small cell, there are three main varieties: adenocarcinoma, squamous cell, and large cell. The non-small cell lung cancer is the type that most people think of as surgically treatable. Unfortunately, only about 1 out of 4 patients with non-small cell lung cancer are candidates for surgery. Small cell lung cancer is generally not surgically managed, but does have a fairly good response to chemotherapy and radiation therapy. Lung cancer takes more lives every year than numbers 2, 3, and 4 cancers all put together. So it is the largest cancer killer in the United States. Risk factors for lung cancer. Everybody knows the main risk factor is smoking. Family history is also very important. Other things like exposure to radon or asbestos or lots of combustibles, working in factories, fumes, paint fumes, these are all risk factors, but the big two, unfortunately, are smoking and genetics. A few years ago, I think it was 2014, the National Lung Screening Trial was published, which confirmed a 20% survival benefit for patients who have lung cancer identified on a screening low-dose CAT scan of the chest. Low dose because it's a lower dose of radiation energy, so less risk, and it's a CAT scan as opposed to a plain chest x-ray, which is much less accurate in identifying lung cancers. Patients with a history of smoking a pack of cigarettes per day for over 20 years, or a family history of lung cancer, could be candidates for an insurance-covered screening test. And again, these tests can benefit by as much as 20% improved survival because the cancers are found at an earlier stage before they spread to lymph nodes. Treatment of lung cancer basically is the big three: chemotherapy, radiation, and surgery. About 1 out of 4 patients are candidates for surgery. 3 out of 4, unfortunately, are at a more advanced stage and can only be treated with chemo and radiation therapy. For those patients in the group that are surgical candidates, removing the tumor and all of the lymph nodes and blood vessels around the tumor are very important. Sometimes patients need additional treatment after surgery, such as chemo or radiation therapy, but really the results are dependent upon the findings of the lymph nodes and the extent of the tumor at the time of surgery, which is determined by the final pathologic result. Patients with an early stage lung cancer with a less aggressive type of lung cancer can expect up to 80% 5-year survival. This is contrasted to the overall survival of 14% for all comers with lung cancer. If there's one takeaway message, it's that early screening, finding this thing before it's advanced to the lymph nodes, is the one thing that can be done that will make a huge difference in survivability.